Hello guys, my name is Kofi and welcome to my YouTube channel, TutorMed, where medicine is simplified. So a brief information about myself. I trained in the University of Ghana Medical School, Legon. Currently, I am a medical officer with the Department of Internal Medicine and Therapeutics at the Holy Family Hospital. So in this video, I intend introducing the channel to you and sharing thoughts on how the learning and practice of medicine can be made simple. If you find this very useful, kindly like our video and hit the subscribe button so that you can get notified when new videos are uploaded. And then put your thoughts in the comment section on medical concepts you wish us to discuss in our subsequent videos. Alright, let's get to it. So regarding what we hope to achieve with this tutorial series, we will simplify the clinical methods used in medicine. These methods, the history and physical exam, aid the clinician to make a sound diagnosis. And as you may know, an excellent history when taken gives about 70 to 80% of the diagnosis. And so it is important that much of our focus is directed at taking a good and a sound history. Secondly, we will look at how to examine the various organ systems and then the right techniques used to elicit a clinical signs. And then we will take a look at how to interpret various investigations, whether hematological, radiological, or the biochemistries, in a stepwise approach. Our next aim is to prepare students or candidates for their licensure exams. And we will do this by giving helpful mnemonics and various patterns of recognition. We will also solve and then analyze various clinical scenarios. Again, we wish to simplify all other medical concepts across the various disciplines of medicine, in internal medicine, surgery, obstetrics and gynecology, and pediatrics. And then we will take a look at some minor procedures. Now let us turn our attention to the framework of our studies. Whenever you draw a framework or skeleton for your studies, there is great understanding of whatever is learned, and the ability to recollect information is faster because the topics are put into perspective. And so for our studies, the first thing we would like to master is how to take a good and a focused history. Next, how to pick up the signs of various conditions. For an example, how to demonstrate by exam that a patient is in shock. And then we will take a look at how various illnesses are diagnosed. Here, the tool we will employ is called the illness script. We will briefly look at this concept in a minute. And then we will move on to interpreting investigations. Lastly, we will review the principles of management of the various conditions. And to say something about the principles: 1. You identify and treat any reversible cause. 2. You manage the symptoms to make the patient comfortable. And 3. You will be on the lookout for complications and then manage them accordingly. Okay guys, now let's take a brief look at what an illness script is. It illustrates the symptoms and signs of a condition, its risk factors, and complications. It is synonymous to a case definition. As an example, let us take a sample illness script for meningitis. It is okay if you are not familiar with the risk factors, the signs and symptoms of meningitis. Just follow along. These things will come up later. And so a typical meningitis illness script will be like this. Anyone who presents with an acute episode of severe headaches, neck stiffness, fever and vomiting, sometimes irritability, photophobia, and who has recently traveled to the meningitis belt, which in the case of Ghana is in the northern part of the country, and who had a prior upper respiratory tract symptoms. This same person has been in contact with a person with similar symptoms, and on examination, Koenig's sign and Bruxelles sign are positive. This script shows the symptoms of meningitis first, and you see that it was followed by the risk factors for meningitis, and then there were positive findings suggestive of meningitis. This is just a brief introduction of an illness script. We will revisit it. Now let us take a look at some of the investigations we'll be interpreting. We have the full blood count, a liver function test, hepatitis B profile, blood urea electrolytes and creatinine, cerebrospinal fluid analysis, urine RE, basic ECG interpretation, plain head CT scan, the thyroid function test, arterial blood gases, plain chest radiograph, fasting lipid profile, cardiac biomarkers, coagulation profile. Bearing in mind that these investigations should be interpreted in the background of a history and a physical examination, they should never be interpreted independently. Now, these are the reference texts we'll be using. We have the Oxford Handbook of Clinical Medicine, Hutchinson's Clinical Methods, Davison's Principles and Practice Essentials, Kumar and Clark Clinical Medicine, Harrison's Principles of Internal Medicine, Medscape, Merck's Manual, and Up to Date, which gives us the current trends in the practice of medicine. So in addition to the framework already discussed, we will solve some multiple choice questions and then analyze problem-based theory questions, or what we commonly know as Section B questions. And then for our OSCEs, we would provide report templates for cardiovascular examination, respiratory examination, etc. And then we'll provide case summary templates also for ward rounds for those of us in practice. These are the styles which will be used in the TutorMed series. We will be using the Doodle Maker video style like I'm doing now. Sometimes I'll be using the PowerPoint presentation style, and there will be instances I'll be writing on the whiteboard with a marker. This is actually based on the responses you gave me regarding how the lectures should be delivered. In summary, let's take a few points. Point number 1, please master the art of a good history taking, because 70 to 80% of diagnosis comes from this aspect of the clinical method. Point number 2, please master the art and skills of physical examination. Point number 3, for every condition, please get an illness script, and you can use the symptomatic approach for this. For example, for a patient presenting with chest pain, if you know the differentials as myocardial infarction, pulmonary embolism, pneumonia, then you can get an illness script for myocardial infarction, pulmonary embolism, and then pneumonia. And for the 4th point, please be comfortable with the interpretation of lab investigations. Point number 5, and the last point, know the principles of management, which are 1. Identify and treat any reversible cause. 2. Manage the symptoms so that the patient gets comfortable. 3. Be on the lookout for complications and manage them accordingly.